Hello, everyone. This is Jen Rumbalski, the director of the La Crosse County Health Department. It is Tuesday, May 5th, and we're glad to be with you today. We are starting our new cycle of media briefings occurring on Tuesdays and Fridays at 2:30. I will start, as I always do, with an update on the current situation, both in La Crosse and in the state. So the current situation in La Crosse County is that we have 33 confirmed cases, and 26 of those have recovered. We also have 2,431 negative results, and that is a 1.3% of positive results to the total number of tests completed. In the state of Wisconsin, we have, as of today, the number of positive results is up 330 from yesterday, and our total is 8,556. Our negative test results are up 3,500 from yesterday. So you can see that we are definitely testing more across the state. And our total negative tests are 83,967. So again, when we look at the total number of positives compared to the total tests completed, we have a 9.25% positive of the total compared to La Crosse counties, which is significantly lower than that. Hospitalizations at the state level today are up 42. That is much higher than it's been in the past few days. We thought we were seeing hospitalizations and deaths decreasing. So it just tells you that we bounce along here. There isn't a significant trend one way or the other. But we are up 42 from yesterday. And our total hospitalizations are 1,663. That is 19% of the cases require hospitalization. The total number of deaths is also up a little more today than it was in the past few days. It is up 13 deaths in our state from COVID-19, which brings us to 353 total. I do want to spend a little bit of time talking about our most recent 7 cases. We've had some questions about those because at the last media briefing on Friday, I did an overview of the first 26 cases. So let me give you a little bit of information about these most recent 7 cases that we have had. So when I look at their age groupings, we have them all the way from, in their teens to their 50s. So we have 2 cases that are under the age of 20. We have 1 case in the 30s, 1 in their 40s, and 3 in their 50s. In addition, we have a variation of the symptoms as well. So we have a total of 3 that are showing mild symptoms, 2 with moderate symptoms, and 2 that are actually recovering and feeling better already. We also know that there are 3 groups of individuals. So the first group has 2 individuals that are spouses, and then another individual that is connected. So that is a group of 3. There is another group, again, connections of 3 cases, and then 1 case that is not connected to either of the other 2 groupings. So that helps you understand that they aren't all unrelated. There are 3 separate groupings. And then additionally, I will just share that we believe 1, maybe 2 of them are as a result of community spread. Next, I want to talk a little bit about the Unicast post that we put on our Facebook page yesterday. So this is the post that talks about, it provides a grade for physical distancing. So first and foremost, I want to just remind you that when we look at the tools that we currently have available to protect us from the spread of COVID-19, one of the most important tools that we have is physical distancing. And this comes back to the understanding of how the virus spreads. And it is spread through expelling through the air, expelling from someone who is infected. Some may have symptoms, some may not. So when you breathe or you cough into the air, those droplets become available in the air for others to pick up. And because of the droplet aspect, we believe that that can be available to someone to take in and become infected within that 6-foot radius of the individual that may be spreading the virus. And again, just reminding that may or may not be with symptoms. We do recognize that there are individuals that are likely carriers and spreading the virus that don't even know that they are doing that because of the asymptomatic aspect of this virus. So when we look at the physical distancing as an important tool, there are not a whole lot of ways to measure the physical distancing and how well we're doing with that. So as with any measurement, including the Unicast website that comes up with a grade by county for how physical distancing is occurring in areas, it is not a perfect measure, but it is one way that we can measure one of our most important tools. So we posted about this weekend where it was a one-day snapshot that indicated we were receiving the grade of F in physical distancing. Please remember that this is a one-day snapshot and that we can get better and we can't get worse than an F, but we can get better and we will fluctuate. But our goal is always to be as best we can with that grade, just because it is helpful to know that we are working really hard to do the physical distancing we need to be doing. So the way that this tool works, this Unicast data, is that it's a change in average distance traveled compared to the pre-COVID-19 period. It also is a change in visitation to the non-essential venues compared to pre-COVID-19 period. And it does measure the probability that does include the probability that two devices are in the same place at the same time. So again, not a perfect measure, but a measure nonetheless that helps us know how we're doing with physical distancing. So I just wanted to share a little more information about that particular tool. And I think the take-home message here really is physical distancing is a significantly important tool that we need to keep working on in order to prevent the spread of this virus. We did receive a couple of comments on our Facebook page, and we look at these, and our team passes these up to me to address on occasion. And there was one that came in that I thought was really important, and it asked about what is the end game here? What are we really working towards? And I want to first recognize that none of us has a crystal ball. I kind of joke about this, that I'm waiting on mine to come in the mail. But I don't mean that to be funny. I mean that to help us understand that even myself and my team, who are constantly looking at the data and the information about this virus, we do continue to learn about this virus each and every day. And the orders that our state and our nation put in place to try to protect us and try to reduce the transmission and spread of this virus are not perfect. There are loopholes and there are inconsistencies, as there will be with any policy change. So that can be really challenging at times, especially when it comes to trying to give good advice and guidance to our residents about what we should be doing. But I think it's important, and I really want this message to be heard, is that we need to be talking about the fact that this virus is likely to have multiple peaks. We aren't choosing the way that the virus acts. We can change it, though, given the actions that we take, the behaviors that we change. Back to the physical distancing piece. If we don't allow the virus to spread as readily as it wants to, we will have less cases. It's just the way that the virus works. We can change how much the virus is able to spread and infect how many people. So I just want to help you all understand that we expect there to be multiple peaks. We don't think we're through the first peak yet at the state level, nor in the county of La Crosse. We had a lull in cases there for about 13 days. That doesn't necessarily mean to me that we left that peak and had a valley. I think that we just weren't testing enough, and we are now testing more, and we expect to see more cases. I think we're still in the same peak. But again, I'm only sharing with you the best information and knowledge that I have. And that's the best that I can do to provide to you all, so that you're, it's very important to me to be transparent and to share with you any and all information that I think can be valuable and helpful for all of us as we make decisions in our daily lives. It is this never-ending balance between saving lives, and particularly knowing that many people in Wisconsin and across the nation and the world have died from this virus, balancing that with livelihood, which is, takes into account the economic aspect and the fact that there might be populations hit harder by this virus than others. And just because we don't have a really high number of cases here doesn't mean that that can't change. So it's this constant balance between risk and benefit, between lives and livelihood. And I also think that, we might be in this for a long time. We've heard 18 to 24 months. We really aren't going to see the end of this until we do either reach that term herd immunity, which means we have enough individuals across our communities and our state and our nation that we are not adding to the spread, that we have enough immunity built up that we are able to fight off the virus if it comes back again. There are still many unknowns. We don't know if one-time exposure and infection gives us immunity to the next exposure and infection. We don't know that yet. There's still a lot to be learned about this virus, and there's a lot of work being done and research towards helping to have a treatment, some kind of a medication or treatment that can support individuals who have disease to help them from being to having such severe symptoms or even dying from it. In addition, there's a lot of work and research right now being done in alignment with a vaccine. So if we cannot reach herd immunity through natural immunity processes where we're exposed and we build up our own immunity from that exposure, then I think, and given the unknowns about whether or not one-time exposure and infection gives us immunity to the next time, really the vaccine becomes an important tool that we are looking towards as that end game, is to get the vaccine in order to have herd immunity through the vaccination process to protect us as individuals from this virus. So that is the end game, really, and that may be 1.5 to 2 years away. Now, I don't want that to make you feel like we're always going to be in the same lockdown process as we are now. We need to become flexible in terms of understanding where is the data, what are the important pieces of data that we can use to measure where this virus is at, and our ability to respond to it. So that is the epidemiological side with the virus and how it's behaving, the public health side with our capacity across the state and nation to reduce the number of cases, and that happens through that disease investigation and contact tracing process that I've talked about in the past, trying to reduce the number of individuals that become ill from exposure to others that are ill. And then also the healthcare capacity, so that if someone becomes ill and needs higher levels of care, that healthcare system does not become overwhelmed. So across those 3 areas, we need to have very specific measurements to be monitoring routinely in order to know, are we in a peak? Are we in a lull or a valley? And between peaks and valleys, or between peaks within each valley, we don't know how long those valleys will be. We don't know how big or how small the peaks might be. But we do know that there will be this loosening and tightening process, so that when we get to a valley where we have less cases, we can be loosening. And that would be the time where we can be carefully and safely reopening things and trying to have some livelihood in between the time periods where we need to be tightening to reduce the spread of the virus. In those times, it's really about saving lives. So I just want to sort of help you understand that this is going to be sort of an accordion style in and out movement as we go through peaks and valleys over the course of the next 1.5 to 2 years. And we need to better understand the details around what we can and cannot do during the courses of a peak or a valley. So hopefully that's helpful and not more confusing. But I think the end game here really is probably around the vaccine process, because unless we find that we do gain immunity through exposure and infection, then we will get some herd immunity built up. But otherwise, it's really going to be the vaccine. So I just wanted to share some of that, because I think it becomes monotonous to be told over and over again what we can and cannot do. And I just like to come back and remind folks why we say those things, even within my own family and how I interact with my own family. I get those questions a lot. Why do I need to do this? So at this point, I just want to say that there really are 4 basic behaviors that we're asking of you, because again, it can be very confusing. If I go golfing, can I go with non-household members? And if that's okay, then why can't I be with non-household members when I'm out walking or hiking? It's very confusing and becomes frustrating, and we get that. It's frustrating to us too. But I think to just kind of come back to the 4 basic behaviors that we're asking of you. And again, the reasons are because we're really facing this virus, and we need to be fighting against this virus and not allowing it to win this battle. So the first one really is household contacts. We should be staying within our household, congregating only within those that live with us in our households. Secondly, we should be maintaining that 6-foot distance apart from each other when we must be outside of our household. For example, when you are in the grocery store getting essential food for your family, those would be the times to be thinking about that 6-foot boundary because of the way that the virus spreads. Third, because it's important to build livelihood into this balanced mix, and it's nice, we need to be outside as much as possible. Being outside helps us balance with health and wellness, doing physical activity, making choices about our health with nutrition and physical activity and exposure to the outdoors, I think is really important. And then fourth would be the travel aspect and limiting travel. Again, thinking about what is essential, what are we really traveling for? It should be getting food, our essential needs, and then staying local so that we are not traveling to areas where there might be higher prevalence of the virus. So with those, I think I would like to now turn it over to our guest for today, who is Dr. Moling from Mayo Clinic Health System. Thank you, Dr. Moling, for being with us today. And Dr. Moling is going to talk a little bit about primary care.
Yeah, well, thanks, Jen. You surmised everything very well. I love the 4 basic principles on the behaviors that we all need to continue during this time of COVID pandemic. Primary care at Mayo Clinic, we've essentially opened our doors have been to seeing patients. We know a number of patients have been needing care, both essential and also the care that we all deserve or need going forward to keep us from getting sick. So here we've been able to open those doors following proper procedures, including workflows, care measures, cleaning process, appropriate PPE, create the safest environment for our patients to come into. At the same time, we continue running as we're reactivating those practices, we're continuing to operate our COVID drive-through process. As Jen had indicated, it's extremely important to continue with testing, knowing what's in our community. I think the fact that our county, Jen and her crew, both organizations, the healthcare organizations, along with EMS, we're out front of this. And with the testing that we've done, we've been able to keep the disease state or the COVID activity very, I will say, somewhat quiet, that valley that we're seeing, and occasionally we see those peaks from now and then, but that's extremely important as we move forward following those 4 basic behaviors. So then that allows us in healthcare to continue our endeavor of taking care of patients. Those that remember at the start of this, everything shut down, all elective procedures went down. We were only doing emergency procedures. But if we see those COVID activity levels rise again, that'll inhibit us from performing elective procedures, elective cases coming into the clinics. But again, our hope is that we continue our behaviors that we've done to allow us to continue to do that. We're following the same recommendations put out by the counties and our states and our nation. That social distancing, we're following that in the clinics. We're doing the face masks. One of the activities or questions that came up was the face masks, the N95 masks that have the ventilator stacks on them, so that people can express air out, which we have now asked that patients do not wear those in our facilities, that they wear just a surgical mask or an N95 mask if they have them, or a cloth mask. Again, that's to protect each other from spreading the disease. That's why we're wearing those masks. Yes, those ventilator masks with the N95s can protect you, but it doesn't protect anybody else. So I want to thank Jen and the county for doing such a great job on everything that they've done thus far, and let's keep it up. Is there any other questions, or how can I?
Thank you, Dr. Moling. I just want to say it is definitely a partnership, and really appreciate you being on with us. I think it's really important to hear about the importance of primary care, kind of bring some normalcy as well, to what we're talking about and going through right now. That, you know, childhood vaccinations are continuing to be really important for, you know, child wellness and all of those sorts of things.
Yep,
so thank you so much for being on. At this point, we will allow questions from our media partners.
Hi, Jen. Declan Levy, News 19. So now as the National Guard is mobilizing more testing teams, has La Crosse County reconsidered hosting a mobile pop-up testing site?
Thank you, Declan. So in terms of considering mobile testing sites through the National Guard, this is a really wonderful resource that the state has allowed, and the National Guard has done some clinics around us. So for example, they did one in Buffalo and Pepin County last Friday. They are doing some in the Western region, Eau Claire, Polk County, many counties as well. There are a few counties around us that are considering having a National Guard testing site. We have been talking about it for the last week and a half. We continue to monitor the number of tests that our healthcare partners are doing, because we believe right now that the capacity is there through our healthcare partners to support the testing that is needed, particularly in relation to those that are symptomatic. So we've been talking to each other to make sure that capacity is continuing to increase and the number of tests continues to go up in our region, and it is. We are always monitoring that, however, and at any given point, if we need to boost that or increase it, we will certainly consider a National Guard testing site. At this point in time, we have not submitted an application to bring a site to La Crosse County. But again, that could change anytime in the future as we continue to monitor that. One other piece of that is recognizing that in addition to a community testing site, which our healthcare partners are providing, and even talking to Dr. Moling, knowing that La Crosse and Monroe counties, Mayo sites have drive-through clinics, you know, those are already present, but we could ask the National Guard to come in and do a targeted testing site. For example, the state is currently pushing to have statewide partners consider testing at long-term care facilities. So we know that there have been cases and outbreaks in long-term care facilities, not in our county, and thankfully not in our county, but certainly counties nearby. And so we definitely want to reduce the chances of an outbreak in one of those settings. So far, we have not had any cases in long-term care facilities, and that is, you know, both a little bit of luck, but a lot of design and a lot of kudos out to those facilities who have worked very hard very early on to make sure that they've reduced the risk through a number of of actions and changes, including active monitoring of employees who were coming to work. Lots of really good steps were taken early on by long-term care facilities to reduce the likelihood that the virus could get into one of those facilities, because all of those individuals are at high risk, and we would definitely see a jump in cases and likely deaths as well. So we absolutely want to reduce that in our county. So we could choose to test a specific target population like long-term care facilities, and we are talking about and considering that. But at this time, we are not currently on the radar for the National Guard to come in. Again, it's a point in time, and that could change at any point as we decide that that would be important.
Hello, Jen. Justin with WKBT. This is kind of a multifaceted question for either yourself or Dr. Molling, whoever can best answer, but it's kind of related to that antibody testing. So, you know, what exactly is one of these antibody tests, and are they accurate? And I know that we're seeing other organizations other than hospitals kind of providing those tests, and can we really rely on those other organizations other than hospitals to give accurate tests?
Thanks, Justin, for the question about antibody tests. So there's a long and a short answer to your question. I'll try to hit the middle ground there. There are a lot of antibody tests on the market. There are some antibody tests being done right now in our county. I think the most important thing for us to know is that antibody tests are a blood sample as opposed to what we call the molecular tests, or the tests that are like oral or nasopharyngeal swabs. And so the antibody test tells us only if we have developed proteins against the virus, which means at some point we may have been infected. It does not diagnose current infection. And so that is why the molecular tests like the PCR, which is a polymerase chain reaction test, which it really detects the virus itself as opposed to the proteins that we produce when we fight a virus. Those types of tests are much more specific and much more accurate right now, and are the way to detect current infection. The antibody tests are more of a tool to understand how many people might have had or have this virus at any given time. And again, it's a different kind of tool and test altogether. It needs to continue to grow and improve in terms of its ability to be specific and accurate. So we are doing our community is doing some of that testing, but it is not a way to diagnose that someone currently has active COVID-19 disease. It just tells us that someone has been infected at some point. So when we get a test result in that says it's positive for an antibody test, then we call that individual and we ask questions about their symptoms, why they got the test, and it helps us determine next steps. But again, it's a very different kind of test, and it has a different purpose. Dr. Molling, did you have anything else you wanted to share on that?
Sorry, I had to click back on here. I apologize. No, I don't. I think Jen, again, is very knowledgeable about this subject. Yes, the PCR test right now is what we're doing for widespread screening in our community. We are not using the antibody test at this time, the serum antibody test, to screen widely. I know that there's a number of tests that are out there. Some have been called into question about their accuracy at this point. The government is trying to sort through that as we speak. But right now, focusing our efforts in this community on PCR testing and doing what we need to do to help control the disease state by doing such.
Thanks, Dr. Molling. Did that answer your question, Justin?
Yes, for the most part. Thank you.
Okay.
Declan Levy, News 19 again. As you reported, just over 2,400 tests done in La Crosse County. So what is a satisfactory amount of testing, or maybe a ballpark number of how many people need to be tested to have accurate representation of the spread?
That is a really good question, Declan. There is no magic number. There are some numbers out there, however, that give us a ballpark. And right now, I'll just throw this out there. I think it would be great if we're moving towards, increasing to 100 and 150 tests per day. So right now we're working towards that number in La Crosse County. And again, this is our health systems serve much larger footprints than just La Crosse County. So their increasing testing is happening at a larger level, of which La Crosse County is just a part of that. So just recognizing, we had been at not quite 50, maybe a week or so ago, and now we're moving towards 70 tests per day. And this is just in La Crosse County. So we are watching to make sure we continue to increase. If that stalls out, or if we are not increasing fast enough, we may call in additional support to get testing. But again, we currently feel like we have what we need in our health systems to provide that for our county. And again, we'll monitor that every day.
Justin again with WKBT. At this point, are there any La Crosse County nursing homes that are reporting any possible COVID outbreaks?
No, there are no nursing homes in La Crosse County that are reporting outbreaks.
Jen, we have a question on behalf of the La Crosse Tribune. They're wondering if we have any more information about La Crosse County hospitals treating those with COVID-19 that live outside of the county, or if we have any of that data.
So in terms of treating patients outside of La Crosse County, again, remember our hospitals serve a large region of counties surrounding us, including not just in Wisconsin. So those hospital systems are set up to make sure that individuals don't have to, like, the barriers to get that level of care are not exceeding their ability to reach it. So we have to have hospitals set up across the state that allow for individuals to get care where they need it. So we are serving folks in our hospitals that are outside of our county, of course. That's the design of the system. And I think if the concern here is about the potential for the risk relating to individuals that might be coming in for testing or care, I can tell you that and Dr. Moling can certainly chime in here, but I can tell you that the hospitals plan for and prepare for those populations and work to decrease that risk. And that we only report for, the way that reporting works in Wisconsin is that we only report for those that live in our county. So if somebody works in our county or travels to our county and lives in another county, their case, if they have a confirmed case of COVID-19, would be reported in those other counties. It's just the way that the system is set up for reporting. Did you have anything to add to that, Dr. Moling?
No, I think the fact that you indicated again, regionally, we serve our communities regionally, and that they're far outstretching all the way to our boundaries, Toma, Prairie du Chien for Mayo, or even all the way across to Rochester areas. Those patients we're here to serve our community, and those patients may end up in our hospitals. They may go through our testing sites. But again, every measure is being taken to do it safely, proper PPE, testing, our COVID testing sites at both organizations really have prevented people from developing this disease state. And I think that's one of the reasons, again, we're seeing such low rates versus individuals not getting the appropriate testing, not getting the appropriate care, and exposing their communities is much of greater risk than both organizations who've taken every step to provide care in the safest manner.
Yeah, we are just so lucky in this area to have such high quality healthcare systems. We routinely get very, very high marks for our ability to provide that level of care for our residents and residents of surrounding counties. So we're very lucky to have those health systems.
Hey, Jen, this is Caitlin with Wisdom. We received a question about the Unicast data. I know, like you said, you'd addressed that already, but some people are saying if we're getting low grades, but still seeing low cases, does social distancing still have to happen?
Yeah, so the grade that happens with Unicast's website is a point in time. So we've seen our grade be better than the state before. Our grade today is better than it was on Saturday. So again, I think what's important is to understand that helps us in a point in time fashion understand how we're doing as a whole. And I think it helps actually remind us of the importance of the physical distancing aspect, because we have been much better than the F grade that we got over the weekend. It was a very nice weekend. People want to be outside. I think there has been confusion about the ability to congregate with others that are outside of the household in groups less than 10. That is not allowable, that we still need to be with our household contacts only. There are like different idiosyncrasies in the order that make that confusing. But that's why I kind of brought it back to those 4 basic behaviors we're asking, and one of them being the household contact aspect, because we are still in a peak and we are not yet in a valley. And until we get to that point, we need to continue to use one of the most important tools that we have available to us to prevent the spread of this virus, and that is the physical distancing aspect. And I am not saying social distancing anymore, because I do want to recognize this can be difficult for individuals in our communities with the social aspect. We are social beings. We are creative beings. And I think that we have to recognize how can we get creative about being social without being physically close together. And again, that is just because we need to prevent the spread of this virus. And this virus doesn't care, about anything other than being close enough to infect more people. So that physical distancing tool is so significantly important. I would not want individuals in our community to take away that because we had an F over the weekend, that is not important to physical distance. I think it is exactly the opposite.
Declan Levy, News 19. So as you mentioned, Unicast as another way to analyze data. Can you just comment on maybe some other avenues such as Google and Apple accessing our locations, and if it's really necessary to sacrifice a bit of privacy to help combat the spread?
So to comment on, I'm not a technology expert in any way, shape, or form. I really don't know enough about how that works. But I can tell you, I don't know of any other ways for us to measure physical distancing. And I think it's pretty clear that I think that physical distancing is such an important tool that even if the Unicast model is not 100% perfect, I think it helps us have a way to see at any point in time, how are we doing? And if that does come from the standpoint of, phones being able to determine that they're close together, I know that can be really concerning to individuals from a privacy standpoint. But I can only comment from the public health, population health perspective that we don't have any other way to know if physical distancing at any point in time is going well or not. And we aren't currently utilizing that to make decisions, but I think it does provide a piece of information that can be helpful for those in our community to see how are the rest of your community members doing with physical distancing. And I'm careful with that measurement because I have in the past and continue to say that this is a fight against the virus and not against each other. So I don't want us to be, calling out that we're not physical distancing in the way that we need to be, but it is such a valuable tool to prevent the spread of this disease that again, it's just one point in time measure that helps us see how we're doing.
Justin with WKBT again. Kind of staying on that F grade discussion here. Did that really take into account with some of these people just kind of hanging out in groups of maybe their family members or people from their household that maybe determined that? I guess although you might have seen some groups out this last weekend, could those groups just been family members or people that actually live together that determine that F, I guess, or helped contribute to it?
Yeah, that's a very good question. I don't know that I have the best answer to that. I think that has to do with how the data is collected, and if it is collected by phones being connected to each other. I think that's one piece of it. I mentioned 3 pieces that I was able to glean from the website about where that data comes from. So I think one piece of it is phones being close together. I don't think that accounts for the whole aspect, but certainly I think it's possible that that could be household contacts with phones near each other. But again, you would think that that would have been the case pre-COVID-19, which is where some of those comparisons are coming from, that those phones would also have been close together during that period. So because of that comparison, I think it's not likely to be a large reason for the grade.
Zach from Levy News 19. So a big and important event this weekend as people want to participate in this weekend's Mississippi River cleanup. So how could they do that safely?
Yeah, so, it's nice to see events where there's a balance with taking care of our environment. And I think, in this example with the Mississippi River cleanup, we want to think about ways that individuals participating in that event can be as safe as possible. So first and foremost, we stick to the 4 basic behaviors that I've mentioned, and that is household contact. So groups that are doing cleanup together should be members from the same household. The ability to congregate outside of those household contacts should be minimized as much as possible. And if there is a potential for congregating, then the physical distancing rule applies very strictly and may even necessitate face coverings, cloth face coverings. Then the rest of it goes back to general safety. And thinking about if you're cleaning up items, you should have gloves and protective gear, and you should be carefully looking at what you're picking up, for example, to make sure that it's not something that's potentially hazardous or dangerous. And there should be trainings that go along with an event like that for those that are participating to understand how they can keep themselves and their family members safe.
Justin with WKBT again. Earlier and throughout this, we've kind of talked about these peaks and valleys. And earlier you had brought up, once we hit a valley, we might be able to open up some more businesses. But I guess if we keep going through these peaks and valleys and having to do more stay-at-home orders and kind of closing up businesses, what does that mean for our small businesses, especially downtown La Crosse here, when we have a really thriving downtown full of small businesses and they're already struggling after about a month and a half now of this? Mm-hmm. I guess with all the funds that have been kind of going to them, I mean, what's that going to mean?
I am concerned about small businesses, and I think, just as I've indicated before, that the livelihood aspect of our ability to thrive includes having small businesses and having local events and those sorts of activities. I think that is the heart of communities at times. But